Hello, everybody. It is a pleasure to join you today for this presentation in which I'm going to be speaking a little bit about a severe crisis during the pandemic that many people don't know about it with respect to the medical laboratory profession. So I'm going to share my screen with you as we get started here. Okay, so again, the title of my slide for the Global Health Security Innovation Week presentation is Medical Laboratory Crisis, the Unfolding Story Inside a Pandemic. So just a little background first, since many of you may not know who I am. My background educational-wise is I have a bachelor's degree in microbiology, so all things in infectious diseases is kind of my specialty areas. I also acquired a master's degree with a thesis in virology, and my PhD was more in the realm of adult and professional community education with respect to how people learn. And so I focused that on more of a public health background around an antibiotic-resistant infection known as MRSA and how people deal with that. I'm also a specialist, so I have credentials in virology. I'm a specialist in virology. I'm a specialist in microbiology, and I'm a molecular biologist. And all of these are through the American Society for Clinical Pathology. So these are credentials that allow me to practice in a medical laboratory or a public health laboratory or something like that. I'm also a global fellow via the Global Citizenship Alliance that I acquired through a really cool event at Austin Community College. And I'm also a fellow of the Association of Clinical Laboratory Scientists and an honorary professor of international studies at Texas State. And then some of the things I've done as we begin this talk about the medical laboratory is as I was going through my bachelor's and master's and other degree paths, my first experience was doing an internship at MD Anderson Cancer Center out near Bastrop State Park, which was just phenomenally cool. I grew up in Smithville, Texas, so it was right near home. And then my first decade of my career was really right in the trenches of public health microbiology. So I worked for about a decade at the Department of Health in Austin. And just a quick note, I worked in everything from rabies to anthrax to plague to hantavirus, and really had a wonderful 10-year career there. I also spent a couple of stints at CDC as a visiting scientist, and we actually eliminated canine rabies from Texas because of the work I did here at the Department of Health. So that's for another time, another story. And then lastly, just again, so you know kind of my context of who I am, I've been an adjunct associate professor at Austin Community College in biology since about 1995. I just started my 27th year there. Love teaching microbiology and biology there. And then I've kind of run the gamut of academia here at Texas State. I came here in 2002 as a brand new assistant professor and have worked my way up to associate professor, professor. I became chair of the clinical lab science program in 2013. I also served as the associate dean for research for the College of Health Professions for about 9 years. And most recently, and really just unbelievably grateful, and it's surreal for me, is that I became a university distinguished professor in 2021, and also a regents professor, which is at the Texas State University system level. And there's only 20 of those at Texas State in our history. So very honored, very grateful for that. I also serve as the associate director for kind of a new area here at Texas State called Translational Health Research Center. We have about 250 to 300 faculty that conduct research in the translational health realm. And so you might hear more about that. You can visit our website to learn more. And then I do a lot of invited clinical stuff around the state as well as the country. I'm really involved in this area of medical laboratory in the public health area. And then lastly, I'm a husband. I have a couple of children that are now college graduates, one from Texas State, one from Trinity University in San Antonio. We love to travel, just everything about family I love. And then really my passions, you can see them listed here. Especially in the last few years, I've just become such a passionate advocate of science communication and health literacy. I love to travel and speak. I love to mentor students and colleagues, and I still love to do research and teach. So all of these things are kind of in my wheelhouse. So let's get started. Obviously, everybody knows that we have been in a pandemic for the past 2 years. And I love this quote by Michael Levitt that says, everything we do before a pandemic will seem alarmist, and everything we do after will seem inadequate. And that has certainly been my experience as a public health professional. Again, I started back in 1994 or so working in that area, and you can never really please everybody. And I think all of you understand that. Most of us are doing our best at any given moment, but it always seems to be a little too slow or a little too fast or whatever the situation is. So this is kind of my slogan when I think about the pandemic of the past 2 years. So here's the context of my talk. I'm sure all of you, every time you turn on the TV or television or the radio in the past few weeks, months to years, you've heard about the dire circumstances of healthcare and public health overall. And so you've seen that doctors and nurses are facing all sorts of stress and burnout. They're concerned about their health. They're also dealing with triage care when dealing with COVID-19 patients, many of them who you know, and I should also throw in long-term care facilities over the past 2 years where people were dying and they couldn't even be around their loved ones. So again, all of that has been just traumatic with respect to mental strain as well as burnout and just stress levels. But rarely do we get a glimpse into the world of the medical laboratory profession. That's my wheelhouse. These professionals labor in the background, but in many ways, they are the beating heart of the U.S. healthcare system. I'm going to share a little bit about them today with you. I recently published an article a couple of weeks ago in January, early January, in The Conversation, and I've actually written about this topic several times of how the medical laboratory professionals are just simply being overwhelmed by a convergence of factors, from burnout and staffing to COVID-19 keeping us away from our job to not even being able to take time off. But the problem has really grown extremely worse. It's gotten to the point now that I talk about it being a national crisis. And so we're experiencing this problem in a real-time phenomenon right now, and it's really impacting patient care and quality. So here's my overview. Why should you care about us or this problem? I'm going to talk a little bit about the medical laboratory profession in general, our severe staffing shortages, and I'm going to kind of dig into the weeds here around recognition, salary, what I call the free agent effect, and the lack of clinical training sites and educational programs, as well as a problem with the lack of national licensure. So these are all things that have led to our severe staffing shortages, and there's some others in there too as you kind of get into the weeds and the nuances of this. So why should you care? Well, again, we form the backbone of healthcare and public health. In fact, if you didn't know this, my alumni from Texas State and colleagues from all over this country conduct about 13 billion laboratory medicine tests each and every year in the United States. As of this month, January 2022, we are approaching almost 900 million COVID-19 tests. That is on top of those 13 billion other tests that we conduct in the US. So it has just been an onslaught, almost a pile-on effect over the past 2 years. If you didn't know this, medical laboratory testing is the single highest volume medical activity that affects your life. It drives about 2/3 of every medical decision made by doctors and other healthcare professionals from cradle to grave. So you should care in the sense that our professionals and this actual activity that we do each and every day of the year, 24/7, 365 days of the year, touches every aspect of your health plan and the quality of patient care. Physicians, respiratory therapists, pharmacists, nurses, they really can't do their job well without that foundational medical laboratory data. And we provide that for those types of decisions to be made. We're a very diverse group of professionals. We have varying levels of education and credentials. Kind of on the front end of our career, you might consider the phlebotomist. You may have crossed paths with a phlebotomist if you've ever had your blood drawn. We can do that blood draw as well, and so can nurses and physicians, but phlebotomists are kind of the front end of our career path. And then really the associate's degree level, the medical laboratory technician. My program at Texas State provides a bachelor's degree medical laboratory scientist. That's really the core professional when you look at numbers, the MLS, the medical laboratory scientist. We also have specialists that have master's degrees and others. And then we most recently added to our profession the advanced professional doctor of clinical laboratory science, the DCLS. There's 3 programs for that degree. You find that at Rutgers over in New Jersey. You can find it at Kansas Medical School, and then also right here in Texas at UTMB Galveston. So we're really excited about that. That DCLS is going to be on the front end of patient care, where they're interacting with physicians and others during rounding and informing physicians about how critical our data is. Physicians and many others need that interpretation of the best lab test, because there's thousands of tests out there that we are experts in. And then sometimes they also need the interpretation of the data that comes out of those tests so that they can make the best informed decision about patient care and surgery and other things. And check out this stat. The U.S. Bureau of Labor and Statistics recently reported in 2021 that employment of medical laboratory professionals is expected to grow 11% over the next decade, from 2020 to 2030. That is faster than the average for all occupations. So we are exploding in employment, and yet we have some issues with pipelines of future professionals, as well as retaining the ones we have. That's the topic for today. So you almost always hear about the impact, again, of this pandemic on those frontline healthcare professionals, right? You hear about physicians, nurses, respiratory therapists, nurses assistants, perhaps others that are in there with your patient or yourself. And perhaps you've seen these people. You obviously have over your life. So those types of kind of patient care, bedside care professionals, everybody knows about it. You know, you're very familiar with that college major. You're very familiar with that profession because you see them and you interact with them. But few people are familiar with us, with the medical laboratory professional. We kind of labor behind the scenes. We conduct all of these complex medical laboratory testing to keep the engine of the medical system running. So without us, physicians and others kind of lose the necessary medical data to take care of patients. Again, we are the bedrock of healthcare when you look at the foundation of data that we provide. Sometimes we even talk about how without us, doctors would just be guessing. And there's no disrespect there to physicians or others, but it's just critical for our data to be there for these professionals to make the best informed decisions for your life. Literally, your life is literally in our hands. So like other healthcare and health professionals, we are suffering dangerously low staffing numbers due to the pandemic. So just a little background as we get into this, we were experiencing these staffing shortages before the pandemic, really for over about 2 decades now. And there's a number of reasons I'm going to talk about that. But going into the 3rd year of the COVID-19 pandemic, and really with Omicron kind of hammering us and piling on in the last several months, it's just caused a record number of high COVID-19 infection rates. It's caused massive problems for our profession, as well as other healthcare individuals and professional pathways for shortages. So here's the bullets I want to talk about as we kind of get into the meat of this and as we wrap things up. One of our major issues is that we are often the science behind the medicine, right? This is one of the hats of one of my graduates from a recent year, 2019. And this does describe us a little bit. We really are behind the scenes. And because of that, sometimes there's no awareness of who we are. And unfortunately, there's no recognition of the critical life-saving skills and educational background that we have. And this really is an upstream and the downstream problem. For example, many of you probably have never heard of this college major, and that's not unusual. So that upstream piece is looking at junior high and high school kind of age kiddos, because they haven't seen us, right? Their teachers, their counselors, their advisors typically are going to steer really strong students and either towards, going to medical school or maybe becoming a nurse or even physical therapy radiation therapy, things that you see and know about. Rarely do you have a teacher or an advisor or even a family member talk about the medical laboratory profession as a college major. This is an extreme problem, and so I'm reaching out to you all to share this information with your family and friends and colleagues. It's a wonderful career. Again, strong academic rigor and wonderful ways to work in the medical laboratory to help impact lives every day. And then the downstream problem is what I mentioned earlier. You just don't see us. So you don't see us practicing because most of what we have to do is behind a biohazard laboratory door. We do get out and about occasionally to draw blood or go on special procedures like a bone marrow draw or something like that, but it's kind of rare. And you might mistake us for a physician or something like that because we're wearing a lab coat and we're kind of tagging along with them. But truly, we are kind of hidden. We are kind of hidden behind the doors. In fact, I once wrote an article called Saving Lives in the Shadows of Healthcare. We're always kind of in the shadows, if you will. So I mentioned we had this problem for really, it's ongoing. And part of that is from retirements. So like most other professions, we've experienced retirements over the years. And because of the high load of testing, we've had burnout. And that's just been exacerbated by the pandemic. And so we're seeing, people unfortunately leave the career completely. I mean, they're so burned out and they're so stressed out that they're kind of moving on to different types of career paths. That's scary because it takes a while to educate and get an experienced medical laboratory professional in the pipeline as well as working. You can't replace these individuals overnight, just like you can't replace a doctor or a nurse. So it's difficult when we lose people, right, to those issues. Some are retiring early. They're just kind of done with the pandemic. They're tired and they're getting out. But interestingly, some have come back. Some have come back, and we have 60 and 70-year-olds working to help us get through this pandemic because they have the credentials, they have the background, and they have the passion to kind of try to help us get through this time period. But we are in desperate issues in this area. In fact, if you look at my article I wrote, many hospitals report around the nation at least a 25% shortage in the medical laboratory. That is, unbelievable. That means if you need 4 people, you only have 3, and you can't really cover the entire lab that way. You need people working nights and weekends and holidays, and it's very difficult if you don't have complete coverage of all areas. Our professionals work really in 4 primary core places in the medical laboratory: blood bank, medical microbiology or clinical microbiology, clinical chemistry, and hematology. And those are just critical areas. I often tell my students, you're really majoring in 4 areas. And then on top of all that, our professionals are responsible for quality control, making sure what data comes out of that test matters and is correct, were the controls in place, were the standards in place. A test is not a test is not a test. It's very, very critical that you have a medical laboratory professional handling these types of tests. Then we have the issue of salary, right? Everybody wants to get paid, but our professionals have lagged behind other healthcare professionals, and this is unfortunate for the reasons I mentioned above, perhaps, as well as reimbursement issues to the laboratory over the years, costs being cut at the lab first before other areas. So just for some context to this, our kind of median salary for our professionals is around $54,000 a year. If you look across the country, again, that's a median, so it's not perfect, but it's kind of a median. And then if you look at nursing, theirs is roughly $75,000, right? So we make about 30% less than nursing, but our degrees are every bit as rigorous. Our credentials are rigorous. And we, again, are the backbone of healthcare with respect to everything we run behind the scenes. So again, that's a problem because people want to get paid, and sometimes they leave our profession to go to medical school or to go become a physician's assistant or something else that might pay them like an industry job in healthcare. The other issue that's happened during this pandemic is something we call the free agent effect. So if you can imagine, the market's gotten so tight for medical lab professionals and nurses and others is that other states and other cities are paying some of our experienced professionals to come to them to travel. And so they might leave, for example, a hospital in Austin, Texas, to go to one in Pennsylvania because they are offering them $15,000 or $20,000 signing bonuses, as well as maybe double the hourly rate. So, you know, a new college grad or even one that's been out a while is going to jump at that because might be in college debt, they might have a family, and who can blame someone for taking a better salary? So that's a kind of a good thing that our salaries are rising, but it leaves a vacuum of experience, and that's a problem for the hospital behind that gets left behind, if you will. We also have issues in our pipeline for creating new professionals. So we have this issue of training sites. So every person that comes into my program must be taking coursework in labs, massive amounts of hours in those areas, those 4 areas I just mentioned, but they also must do clinical rotations, just like a nurse or a physician or others. So they have to go work at different hospitals around the state of Texas, for example. Well, because of all these shortages and burnout and other things going on, there's just not as many people to train and educate our students. So literally the single biggest limitation on my program is clinical sites. So I get 40 to 50 applications a year, but I can only take 20 students. So I'm basically turning down 50% increase of students that I could have if I had more places to place them. There's also a lack of educational programs in general. States like New Mexico and Nevada have a single program to train these professionals, these future professionals. Fortunately, in Texas, we have over a dozen of both the bachelor's level and the associate's level, and we have a lot of master's degrees, and we have a doctorate at UTMB Galveston. So we're pretty fortunate in Texas. That's not the case. That also means that I'm getting students from around the country competing with Texas students, and those students may go back home. So again, it lends to this problem of a pipeline shortage that it's not going to be created in a better way overnight. We need serious discussions with clinical sites, and we need help to fix that problem. It's a national problem. We don't have national licensure. So in some states like Texas, we have a credential, a certification, which is what we have. It's still really critical. It acts like a license. You can't practice without it. But other states have licensure, like New York and California and Louisiana. And so we really need that. We really need a way to work on congressional movement through our professional organizations and individuals to try to get licensure in Texas and elsewhere so that we have a more even playing ground with respect to how people view us. And then we're often the first cut. So we have reimbursement issues. The laboratory is often working, you know, at a way less staffing than they can withstand. I have personally seen during this pandemic labs in Texas that only have 2 or 3 medical lab professionals, and they need 8 or 10 to truly do the work they're doing without burning out. And so these individuals might be working 10, 12, 14 days in a row at 12 to 14-hour days, and they can't take off because they have a guilt in taking off, or they're worried about leaving their colleagues, you know, at lower levels of quality. So it's just this ongoing dangerous effect where you see people burning out and the mental strain is piling up. So those are just some of the severe staffing shortages, and I hope you will share those with your friends, family, and colleagues. Here are some references and resources for you. I have done everything from TED Talks to video interviews to written articles and explainer articles. Here are some of my resources, as well as the Joint Commission and ASCP. ASCLS also has some wonderful resources of articles and videos. And please share this major: medical laboratory scientist, medical laboratory technician, medical laboratory professionals. Please share that with your friends, your colleagues, your family, your social media outlets, and help us get the word out so that we can provide you the best quality care on any given day. I'd like to thank you, and we don't have any questions since this is a virtual moment right here, But when this is shown live, perhaps I'll be able to answer some of your questions. Please feel free to follow me on Twitter personally and with my CLS program, as well as the Translational Health Research Center. And I hope to see you or someone related to you or friends coming into my program someday at Texas State University or elsewhere around the country. Thanks so very much.